There's a lot happening with New Jersey's child welfare system. We want to help you make sense of it and share our story. This is DCF on the Air.
This is DCF on the Air, and I'm Jason Bukowski. April is Child Abuse Prevention Month, and I want to point out that the work that we do within the Department of Children and Families to prevent child abuse and neglect, that doesn't happen just through our agency. It really involves a whole network of stakeholders, a larger child welfare system. And I've talked about this on the podcast previously, that the child welfare system is not the child welfare agency. It's much broader than that. Today, we're inviting some of our partners from that stakeholder community through the New Jersey Task Force on Child Abuse and Neglect. And that's a panel of the stakeholders that are deeply committed to the same vision that we are, that all New Jersey residents be safe, healthy, and connected. So I'm going to turn it over to my two guests to introduce themselves, and then we'll get into the conversation.
Good afternoon. Mary Coogan, President and CEO of Advocates for Children of New Jersey.
Hello, I'm Carissa Kazar, Director of Family Support at Umbrella.
Thank you so much for joining us, and welcome to DCF on the Air.
Thanks for having us.
Mary, my first question for you is, can you talk a little bit about the history of the task force in New Jersey, and what has its role been historically within the child welfare system?
So the Task Force on Child Abuse and Neglect was originally created by an executive order of the governor, I think in 1983, and it was really to respond to child abuse and neglect and to create some type of statewide system to address child maltreatment. Then in 1996, there was actually legislation passed which made it a more formal entity and determined the membership. So these were representatives from different state agencies that might interact with child abuse and neglect cases, and then some public members. And the mandate was broadened to look at the practices of our then Division of Youth and Family Services, which was our Child Protective Service agency, in terms of both their efforts to protect children and also to prevent child abuse and neglect. There's been other amendments since then, and really the task force took on more of a role of looking at creating a prevention plan statewide and really saying, how do we make sure kids are not abused and neglected, and how do we strengthen families so that doesn't happen?
Yeah. And right now you're serving as co-chair of the task force with the commissioner.
Correct.
But you've been a member of the task force for longer.
I actually joined the task force in 2017.
Okay.
But my former boss, Seals Alkin, who was the president and CEO of Advocates for Children of New Jersey, had been a member for many years. So AC&J has been part of the task force for an extended period of time.
Great. In your time, and it could go back into Seals' time as well, but thinking about your exposure to the task force and probably like the early days of their mission, how have you seen that sort of evolve over time?
So I think the early days of the task force, like I said, was really to create some type of a statewide response. I think it's much more focused now on looking at prevention services. I think back in the early days, there was some funding that was given out in terms of grants to different community organizations that were engaging in efforts to strengthen families and prevent child abuse and neglect. And so the task force was focused on monitoring those grants, giving out that funding. Over time, I think they tried to make a better statewide system, both in terms of using evidence-based practices for the investigation of child abuse and neglect, for providing services, for the efforts to help children who were victims of child abuse and neglect. But as I said, to then really create a statewide plan of prevention. And that's where you started to see more interaction of the different state systems that are part of it. Community Affairs, Department of Education, Department of Health. What could all those state systems bring to this effort to strengthen families and protect children?
Yeah, it really is a systems approach, and bringing in partners from other agencies, partners from the nonprofit world, to really push this singular vision forward, I think is one of the strengths of our system.
Well, it is. And I also think the current Commissioner Christine Beyer, I think what she has really taken it to the next level by saying, it's not just about the Department of Children and Families. It's all of us in it together, like you said. And so really saying we need to get family voice in there. We need to get the youth voice in there. And now how the state has been able to exit out of the federal lawsuit, which we'll talk about at some point, a committee of the task force, which is the, and I always forget the name, the Staffing and Oversight Review Subcommittee, or we call it the SOARS, which had initially been created when the litigation, the federal court action reached a settlement point, and it was specifically to look at staffing issues of the division. And now that the SOARS has really become somewhat of an oversight body, but to really look at the performance of the Division of Child Protection and Permanency and the department to make sure that there is some type of an annual review, but by a diverse public stakeholder group. And so the makeup of that subcommittee has changed and will rotate. So there will always be new membership, but it's I think what the commissioner sought to do and is accomplished is making sure that there are parents on that, there are youth on that, there are providers, there are faith-based community organizations, as well as what we typically call the stakeholders, which are the courts, the attorneys, et cetera.
Yeah. You mentioned the subcommittee, or Staffing and Oversight Review Subcommittee,
Correct.
The SOARS panel. And with the task force itself, the task force as a body does a lot of work, but also much of that work happens within the subcommittees. And, full disclosure, I do chair one of those subcommittees, the Small But Mighty Marketing Development and Fundraising Subcommittee. I'm going to put that on my business card, Small But Mighty. People wouldn't normally say that about me, but in this case, Small But Mighty works. Carissa, I'm wondering if you could talk a little bit about the subcommittee structure and what are some of the areas of focus for some of the subcommittees of the task force?
Yeah, absolutely. So majority of the subcommittees, the one that I currently chair is the Family Support and Child Wellbeing Subcommittee, which was formerly Prevention. With that, we have two co-chairs. Usually one of the chairs is Assistant Commissioner for State of New Jersey. The other co-chair is a non-DCF representative. So they are voted in, which is me in that subcommittee. And within that, we try to get members involved, like Mary was even talking about, of, representation of all elements of New Jersey. So even on our subcommittee, we have representation from education, pediatrics, legal, family and community support providers. We are hoping to even get, parents on, just your average parent, Department of Housing involved. So trying to cultivate members from all realms of the state of New Jersey, because this is the full community coming together for the betterment of the community. So, a lot of the focus tends to be with different subcommittees. Mine, naturally, I can talk about is, how do we look at all the services that are provided within the state of New Jersey? Where are the service gaps? With those services, how do we continue to develop a high quality, accessible, culturally appropriate services for all New Jersey residents? How do we continue to make sure that that is a strong base for the state of New Jersey? Because we want to, at all realms, prevent, and that's where we were formerly Prevention Subcommittee. But we wanted to kind of bring it a layer deeper. So each committee, even, child safety, their committee is that focus on, okay, prevention was missed. Let's do a catchnet committee to look at what are some of the elements that we need to put in place for children that are at risk currently. So I think, the task force has done a wonderful job in trying to cover all bases for the state of New Jersey, for our children and for our families. Yeah.
And I want to acknowledge, so it's the Family Support and Child Wellbeing.
Yes.
Safety of Children.
Yes.
Now I'm struggling because this used to be the Protection and Prevention Committees, but
and then there's the Race, Neglect,
Race,
and Poverty.
Neglect
And that's the new
Subcommittee.
one.
That's a relatively new one, but that's focused on the issues that sometimes we conflate. And this is, all child welfare systems conflate issues of poverty with issues of neglect.
Yes.
And how do we better support families without deeper involvement in the child welfare system? And then, of course, SOARS
Mhm.
and the Marketing Development and Fundraising Subcommittee,
That
which
mighty
is
subcommittee.
Yes.
mighty subcommittee that's focused on how do we raise funds for the Children's Trust Fund, which is also an avenue of prevention funding in the state of New Jersey.
Yeah.
I also would be remiss if I didn't acknowledge that from your day job, you brought your mascot.
I did.
Yeah, we're having a
yes.
little bit of a play date, the two
Yes.
mascots. So it's good to see that happening.
Absolutely.
I'm wondering if you could talk a little specifically about the work of the Family Support and Child Wellbeing Subcommittee.
Yeah.
And some of the specific recommendations or some of the work that you're currently doing to really advance that prevention forward strategy for the child welfare system in New Jersey.
Yeah, and we have a really high focus of the primordial focus, which is looking at all elements of New Jersey, social wise, economic wise, environmental wise, even of, using that as our main focus for how do we stop risk factors from even happening, right?
Yeah.
Risk factors are the sign that, abuse or neglect may occur. We want to stop even those risk factors. We want to bring it down to the very base. So we are looking at conversations of how do we provide more in childcare deserts? How do we provide more in food deserts in the state of New Jersey? How do we provide more in birthing deserts in the state of New Jersey? And it's kind of crazy to think about. The state of New Jersey is so tiny. We have deserts, and yeah, there are pockets within the state of New Jersey that there is no birthing hospital.
Yep.
There is no source of nutritious food for our families. So breaking it down and really looking at the data and, seeing where are these pockets and what else needs to be done. And one of the main areas that we're working on, and also a big focus for us, is we do put together the statewide prevention plan. So it's a 4-year plan that we work on and we put forth to the task force to approve it. And we're working right now on our 2026 to 2028 prevention plan at this time, and currently looking at some of the priorities we had for the last one and seeing how do they still correlate. So how do we make sure that all services are racially equitable, culturally appropriate? How do we make sure that we're staying data driven with our decision making? So right now we're currently working on elements of, what needs to stay, what needs to be revamped, where do we need to go with it, and everything is what we're working on at this point in time. But we also have some challenges that we're going to be facing with potentially the federal SS Block grant being blocked, as well as Medicaid. The SS Block grant is $43.3 million that comes to New Jersey for services. It provides, casework, salaries, rent, transportation, and also with Medicaid, that's children in care. That's their insurance. That's foster care subsidies. That's adoption KLG subsidies. So if these realms get cut, which it's a very real reality we're living in right now, that it can very well happen. If those things happen, what kind of prevention plan do we have? What do we do? Because if those things get cut, you're going to see a lot of services that have already been established, that are working, that have been proven to work, that are just going to disappear. I think it was 700,000. I believe it was noted as residents will lose Medicaid. They could lose their Medicaid. So it's kind of our own congruent planning for what we normally would, just with how things are in the data that we have, but then also too being prepared of what does it look like for New Jersey and for our families that need these services. Sure. So kind of doing both worlds.
Yeah. And you mentioned the social services block grant, which I think is $43 million on the federal side that comes to New Jersey, that really supports the operation of our child welfare system.
Yes.
In addition to that, there's the Medicaid cuts. Our children's system of care is built on the Medicaid platform. Yeah. But beyond that, there's also indirect cuts resulting from the federal matches on some of the funding for adoption subsidies, kinship legal guardianship. The list goes on and on.
Yes.
And I think that kind of speaks to one of the key capacities for the task force is around advocacy. That the task force makes recommendations annually to the child welfare system, to things that we can do within the child welfare system. But I think it's also a way of mobilizing advocacy from our system partners. And I think that's something that, we had talked a little bit about a little earlier today, actually.
We did talk about that earlier today. So I do think this is reflective of the potential of the task force and how it has changed. I think early on, as I said, it was created to react to a problem. I think there have been years where I've been involved in the task force where I think it was much more of the department doing a report out about what was happening. And I think part of that was because the department was under a federal court order and oversight. And so it just didn't seem as active. And I think there's been a movement because of some strategic planning that we've done on the task force to say, where can we help families? Where can we be value added? We shouldn't just be getting reports. We should be doing something, right, in a positive way. I think that's changed. Your comment about we had a meeting earlier today and people were reporting out in terms of the potential cuts. And New Jersey could see approximately $10 billion loss in Medicaid funding, as well as loss in funding for SNAP, our Supplemental Nutrition Assistance Program. School meals could be impacted. There's already been some funding cuts to funds that the Department of Agriculture sends New Jersey, which bring, fresh produce from farm to table for our schools, but also for our food pantries, right? And so from speaking with legislators here in New Jersey, we don't have that $10 billion or any portion of that to make up that cut if it is cut. So to Carissa's point, I think we really do need to think about it and plan for it, right? But in terms of, it's almost overwhelming when you think of the great job that New Jersey has done collectively working together to really stretch or utilize whatever dollars we were getting as effectively as possible. The children's system of care is a perfect example of that. So you have families whose children have a behavioral health issue or an emotional problem or is in some type of crisis. Any family in New Jersey can call mobile response. Somebody will come out and stabilize the situation, but then refer the child to get services through the CMO, the care management organization, to address whatever the problem is. And that could be a variety of services. If the family has insurance, of course, they'll use that insurance. If they don't, if they're on Medicaid, that funding pays for it. But if there isn't something or there's not enough in terms of coverage, the state picks up that bill. And that, as I said, is available to everyone. So if you start to lose Medicaid funding, that will start to pull that funding to pay for something else. And then the state would have to make up the difference, and they don't have that money. And so from my perspective, it's such a wonderful program. It's not perfect, but it does a lot of good. It helps kids with disabilities. It helps kids who have behavioral problems. And we could really just see that whole system fall apart.
Yeah.
So what do? And one of the things we've talked about is, first, we do need people to tell their stories. So if there's anyone listening to this podcast whose child has used the children's system of care, whose child is getting some type of services through the school because of a special education need, a health need,
or even a resource parent receiving subsidies,
right. You need to be calling your legislator, but also your members of your congressional delegation, and tell them what that service has meant to your family. I also am reminded that when the state shut down our public health insurance system, which is New Jersey Family Care, the numbers were so expanded at that point because people either lost their job, they were furloughed, they were, laid off for a period of time, and they, for the first time, were enrolling in New Jersey Family Care, getting SNAP benefits, utilizing those programs. They will not be available if there is another crisis, if we see these cuts. And so the other thing that people don't understand is that even if your family is not directly impacted because you're in a program, if people lose their Medicaid coverage, then they will now go to their community hospital to get their health care. And so your community hospital may now become an urgent care, right? Where that's your hospital and you might not be able to access the care you need. Or if that hospital is supported heavily by Medicaid dollars, that hospital may no longer exist. And so your family may have to drive further to get the services you need. So there's lots of ways that people are going to be impacted by these cuts that I don't think people really appreciate. So one of the things that we've talked about is making sure that everybody understands the implication of the cuts, but then going that step further to make sure that they reach out to their congressional delegation. That's both House of Representatives and our two senators. We have two, Senator Booker, Senator Kim. I think some of our members are supportive of Medicaid and are opposed to any type of cuts. That doesn't mean they don't need to hear from you. Right. They still need to hear the stories to make the case to their colleagues who may have a different perspective on this. I understand people are saying, we need to cut our deficit, et cetera, but I think this is a huge cut. This is something which is going to have devastating impacts on families in New Jersey.
Yeah, absolutely. And just to piggyback off of that, it is, the argument of, we have a deficit and that's where this is kind of all coming down from. But the reality is that this would actually create anywhere between a $7 to $9 billion deficit for the state of New Jersey. And that is going to impact everybody. It doesn't matter if you have nothing to do with child welfare, it will impact you in some way. Between services disappearing, like Mary is saying, you're going to have to travel for things. It's not going to be what once was. And we've come very far for the state of New Jersey. So it's a very hard pill to swallow when we've been so progressive and we made so much impact to children and families. We still have a long way to go, but we've made such good strides, and this is going to kick us back tremendously. And I really encourage anybody that is going to reach out to representatives, if you're intimidated by it, if you don't know what to kind of do, reach out to, Umbrella, reach out to, ACNJ where Mary is, talk to other service providers. They'll be able to help guide you because it can be a little intimidating, talking with a representative or reaching out to them. And it shouldn't be. They're just like us, right? There's no difference. They're just like us, and they're there to represent you. So, I definitely encourage that as much as possible.
Yeah. And I think it speaks to, one of the core beliefs that we've had through this podcast is the power of our story.
Yes.
And sharing your story, that's powerful.
Mm-hmm.
You can sway public policy. The other thing, switching hats briefly, but putting on my co-chair hat of the Marketing Development and Fundraising Subcommittee. This is a cut that we're not going to be able to fill in the state of New Jersey. If all of these cuts come through the way that they're being proposed, this is not something we're going to be able to fill the gap.
Yeah.
But we also have this Children's Trust Fund, and even small donations into that Children's Trust Fund can go a long way, can make a big difference in supporting innovative prevention in the state of New Jersey. So I do want to shout that out, that if you are a resident who is concerned about this and wants to do something about it, you can donate to the Children's Trust Fund, and your small donation can go a long way. Yeah. I just wanted to do my little
and I'll
Jerry
add to that.
Lewis.
No, but I'll add to that. Right now, people are doing their tax returns, right?
Yeah.
Exactly.
And there's a box on your tax return, Children's Trust Fund. You may have seen that with other items that you can donate to and said, what is this? Well, this is what it is. It's actually pulling together funding by which the task force can try to assist in the provision of community services to help strengthen families, prevent child abuse and neglect, and help kids.
Yeah, I actually do my taxes. My wife lets me do my taxes. Let's do our taxes. And I've been donating to the Children's Trust Fund because I recognize that it's so important. It also is, a little bit of self-preservation because I am the committee chair of this committee raising funds. So I'm not putting in my own money. I think that would look a certain way. Yeah. But I do want to go back to something Carissa said about the progress that New Jersey has made. And we have come a long, long way. And Mary, I think you alluded to it too, in the history of the task force and the history of the department. We were previously under federal oversight. We're no longer under federal oversight. We've satisfied the courts that we are a system reformed. Part of the agreement to satisfy all of the provisions of the court was that we had a mechanism for public transparency and accountability of our work, and that's through the source committee. And I'm wondering if you can talk a little bit about what that looks like, what their process is, and how we're partnering with them to continue to share about the good work that's happening and to hold us accountable to those standards of progress that we've made.
Sure. So as you said, there was a lawsuit. There were a tremendous amount of reforms, also tremendous amount of resources put into what was the new Department of Children and Families. People will call it transformational. And I know the commissioners said that on several occasions because it has been transformational and much progress has been made in terms of reducing caseload sizes. We don't have the turnover we used to have of caseworkers. There's been a lot of training, there's supports in place, but more importantly, the system itself in terms of being more accountable. The department is creating its own quality review process. So there was a federal monitor. It was Judy Meltzer through the Center for the Study of Social Policy. And part of the exit plan that the court approved was that the SOARS would now become the entity through which there would be some type of an annual performance report of the Division of Child Protection and Permanency by what we would consider a diverse public body. And so the SOARS membership was changed so that it will be every 3 years, there'll be turnover of a certain, like a third of the group. And it will not just be the stakeholders, meaning the attorneys or the courts who are part of the subcommittee, but it would also involve parents and community people and youth. So one of the things that the legislation also said is that they would get assisted by the department to hire some type of an expert. And we had the Camden Coalition last year. Montclair University now is going to provide that service this year because the people on the SOARS aren't in the position, many of them have day jobs, in the position of gathering all the data and things we need to look at. So you have an entity who's going to help do that. And if you can get a copy of the current SOARS report on the department's website, but you'll see there's certain data indicators that we're tracking and continuing tracking. So how long are kids in care? How long does it take to get an investigation done? Are kids getting placed with relatives? All those things that the department prioritized to make sure they're still on track. But then looking in specific areas where people want to have more conversation and have a better understanding. So this past year, some of the SOARS members actually started participating in the quality review process that the department is unrolling. We got a better understanding of the new case practice model that is being rolled out, which is really more a solutions-based casework, which sort of changes how caseworkers interact with families and how that is improving relationships and engagement of families. So all of those things, the members of the SOARS committee are continuing to learn more about and reporting on. The other thing that the legislation did, well, actually, I can think of a couple things, but one of the main things, again, in the interest of being transparent, was that there will always be data made public. And so the department, anybody can see it. Rutgers has a child welfare hub. There's also a data hub for the children's system of care, and people can go to the department website, click on it, and there are all kinds of data, which you can spend hours, but seeing the improvement that's occurred. So in terms of the number of families who are now involved with the department has been reduced by 20,000. Let's say over the past 20 years. The number of children in care, in foster care, are at an all-time low. I think there's less than 3,000 children in care. Yep. The amount of time it now takes for a child to go back home with their parents or to be placed permanently with a relative, or if they have to be adopted by another family. All those timeframes are on there. I think we still struggle, and this is another focus of, I know, the department, but also other groups like the Children in Court Improvement Committee, is that we still have too many children of color who wind up involved with the Child Protective Service system. I know that is a mission of the commissioners to address that, and there have been efforts made, and that's part of the work of the Race, Poverty, and Neglect Subcommittee. Separating out those calls that come to the hotline that are allegations of neglect. And I think you mentioned this earlier, Jason, we conflate what some people think is neglect, and it really could be poverty. Sometimes families are calling on themselves, right, to the hotline, they need help. Sometimes it is a teacher or a provider who realizes the family needs help and they don't know where else to call. So that's the type of work that the task force subcommittees are looking at. And some of the work that Carissa's subcommittee is doing is, where can we ensure that these families have another place to get help? Or if I have a concern about a family, rather than having to call the hotline, how can I connect the family with the community provider? How can I connect the family with the faith-based group that's working on something? How can I connect the family with some type of housing assistance? Right. And I think, especially in light of cuts that we can anticipate, it is even more critical that everybody really work together at a local level, at a community level, and at a state level to make sure people do know where all these resources are, and that we connect families to the resources they need and not create further barriers to them getting the help they need. So that's some of the work that the SOARS is doing, is looking at the data, but also looking at how is the division continuing to perform and meeting the objectives it has set. How is the staff still doing? We're still looking at staffing issues, but how are the kids doing? How are the families doing? And then sharing that information with our colleagues who are involved in other committees, so that we're all working collectively to help strengthen families and help kids.
And I wanted to hit on too, because I think transparency is really super. I've always, in my work, I'm very big on transparency. And that's one of the things that I truly love about the task force, is that it is very transparent. People can go on our website, on the DCF website, they can see the minutes for meetings. If anybody's interested in just attending any subcommittee meeting, they can reach out and just attend, just to hear what the conversation's about. And then if they're interested in joining, they can always apply to join. But that's one of the things that, I think a lot of people don't know about task force. And that's why I'm happy that you're doing this on the podcast, because a lot of people, I say, oh, I'm on task force. And they're like, what is that? So now that a lot of people are aware of it, especially your average New Jersey resident, are not aware of it. And then when people see it, they kind of get, oh, that's a government thing. Oh, that's a state thing, and yes, we're a part, but we're not of, and we're a whole mix of different representation. Many of us with lived experience, of being in care, or, things like that. So it's a whole plethora. And we really want regular parents to also have a voice at the table, as well as our stakeholders and other representatives from out the entirety of the state. The more representation we have, the more voices we have, the stronger we are able to make good decisions for all of New Jersey.
Yeah, no, absolutely. Yeah. And I mean, to speak to that point, I know that actually today we voted on a co-chair for the Race, Poverty, Neglect Subcommittee, Kay Ann Foster, who's actually been on this program before, to talk about her participation in the film Truth to Transformation, but came to our system as a system co-designer based on her lived experience. So she was part of that Powerful Families project that we had initiated, and really has been just a powerful advocate for change and transformation in our system. So it really is all walks of life. And I think one thing that we didn't talk about earlier when we talked about the makeup of the task force is legislators sit on there as well.
Oh, that's true.
Yeah. So I think this question goes to both of you. And you've already kind of made this case. You've definitely made this case to me, at least. But really succinctly, to talk about What do you see as the value add of having a panel of stakeholders, policymakers, average citizens, people with lived experience, to have that role as a partner in but not of, as you mentioned, to help us advance a child welfare system that we can all look at as one of the leaders in the state of New Jersey that's advancing the type of vision that we have for the families that we support, all of us through our individual day jobs.
Yeah.
So the value add is dependent on active participation by the task force, right? So as I said earlier, I think there was a period of time there where the task force members came to a meeting and just got a report out by the then commissioner, right? What was happening with the reform effort. And I think people were not as engaged. I think because of the strategic planning, because there's been efforts to get engaged new members, we voted on a lot of new members today as well. I think people are more engaged. They're more excited about trying to accomplish something. And I'm hoping it's because they feel that the task force values what they can contribute, whether it be their lived experience or their professional experience. So the benefit of the task force and some of the subcommittees is that you have people coming from different walks of life. And the thought is, if you have educators and psychologists and medical doctors, and you have teachers, and then you have government people, but then you also have parents and you have kids, that collectively we can try to think outside the box to solve these problems. So, for example, for many years, and I think traditionally, the child welfare system has been viewed at what is the agency? In New Jersey, it's the Division of Child Protection and Permanency. And so the agency gets a referral, they investigate, they determine how best to make sure the child is safe, hopefully is still at home, provide the services. If they have to remove the child, they try to get the child back home in a timely manner or find the child another home. And that's it. That's what people think of. And I think in New Jersey, through the commissioner's work, but also just conversation of people seeing the reform effort, we're now saying the child welfare system is all those systems that touch kids and families. So it is also the healthcare system, it's the childcare system, it is the law enforcement system, it's a criminal justice system, but it's also those other supports, right? It could be Department of Human Services, the social benefit system. Because our goal, and I think the collective goal now, is to say, how do we continue to make sure families never have to come and become involved in the system? How can we make sure that there's never a referral made to the hotline on this child? And can we make sure that happens, because we have ensured that families have whatever they need to help themselves become a stronger family unit, right? Yep. So the community has to get involved. And I think that's the energy I see in the task force, is how can we work collectively together? And where there are problems, because there are always going to be problems in a child welfare system, right? You fix one thing, something else, happens on the other side. That when those things happen, it's not an accusatory framework everybody's in. It's that could have been me. So how can we work together to fix the problem and make sure it doesn't happen again? And I think as long as people are talking and collaborating, you can achieve so much more. And to me, bringing all those resources and those thoughts together and the experience of all these people makes for a more enriched and informed conversation, and hopefully better outcomes for kids.
Yeah. No, I love that question. That's my favorite question.
Okay.
Because it's imperative. Like it's so imperative that everybody has a seat at the table. You can't you can't provide good services and good answers to a lot of questions unless you know what it's like to be in somebody else's shoes. So you can't just have the policymakers, you can't just have the other stakeholders, you can't just have DCF workers. You have to have everybody at the table to talk about this is what's going right, this is what's going wrong, and really hear those stories, because that's what's going to make the impact. For our committee, one of the things is that it always comes to mind the story of, it's kind of a weird story, but the story of the kids falling off the hill. So there's a hill and these kids keep falling off the hill. So all the paramedics come and they take care of the kids that fell off the hill. Why is nobody stopping the kids from going on the hill? So that's what my subcommittee is working on. How do we stop the risk factors from even happening? And what are those risk factors? Is there a gate at that bottom of that hill? Who is looking out for these kids? And we need everybody's perspective to be able to actually put forth solid recommendations to the overarching New Jersey task force to hopefully make those implementations and those changes. And then, and again, we do the big prevention plan, which is the big one. But then throughout the remainder of those years, that's what we're looking at. We're monitoring that. Is that being met? Is that still working good? Does anything need to change? What are some other things that we need to be putting in those interim periods in the meantime? And what do those recommendations look like? But it is imperative that we have as many voices at the table as possible. Yeah.
And Mary, you spoke about it, but your vision of what the system is, Chris, I'm wondering if you could share what you think, what as you define it, what is the child welfare system in New Jersey?
Oh, it's everybody.
Yeah.
I mean, there's a state agency that has the mandate to respond when a child is hurt.
Mm-hmm.
But if you're really looking to improve outcomes for children and make sure that they grow up to be productive, emotionally well adults, it's everybody has a role to play, and that the child welfare system is all of us.
Yeah, that's exactly how I look at it. I look at it as it's community caring for community. I think a lot of times, generally people forget kids grow up. So every time you say children right now, but what about those children 10, 20 years from now? So it's constantly reminding that our kids who are in care right now, and our kids that are across New Jersey right now, whether in care or not, they're going to grow up, and how do we provide, not rose-colored glasses, basically, but how do we provide at least those basic safety and get rid of those risk factors so that they have the opportunity to grow and be safe, healthy, and connected, so the same motto of DCF as a whole. And we do that by the whole community coming together. I know DCF recently rebranded to It Takes a Village, and it does. It does, and those kids will grow up one day and they'll be the ones, leading their lives and dealing with whatever repercussions that happen when they were a child, so yeah, so it really is. It's community caring for community so that we can have successful adults, that we can have kids who are thriving. So yeah.
That Join the Village tagline, that's for our foster care system specifically. But I think it does speak to this idea of all of us sort of joining in this effort together. That this is a collective effort.
Yeah.
A lot of times when I think of system, I think it's those partners that we know about. Like if I said the child welfare system, we know that there's going to be a partnership with the Department of Human Services.
Right.
It's, if I think about the children's system of care and the adult system, there's a partnership there.
Mm-hmm.
If it's social services, there's a partnership there.
Yeah.
Department of Health, there's going to be a partnership.
Mm-hmm.
The early intervention services dovetail into our early relational health work at CSOC, and infant mental health and support for individuals with intellectual and developmental disabilities. So that's an easy partnership.
Yeah.
Department of Agriculture, food security, Department of Community Affairs,
housing. Yep.
But it's also those non-traditional partners, transportation.
Yeah.
Transportation is a huge issue for families in the state of New Jersey, where we don't have, if you're looking at a child welfare system like New York City, It's one city, and they have the biggest mass transit system in the country.
Yeah.
And if you need to go anywhere, it costs $6, I think, to jump in a subway
Yeah.
and go to wherever you got to go. We don't have that in New Jersey.
Right.
So transportation is key. So it's all of those partners,
Everybody.
traditional and non-traditional. It's everyone.
It's
Sure.
everybody.
Mhm.
So with that said, what exactly is the task force looking at as far as future actions to ensure that collective vision that all children can be safe, healthy, and connected in the state of New Jersey? What are we doing?
So we've talked a little bit about the different subcommittees, right? So I think Carissa shared some of the work that her subcommittee is doing. I know the safety subcommittee, or the committee focused on child safety, is really, again, taking the data and saying, where are we seeing numbers increasing where we don't want them to see increasing? And they're looking at different populations, what we call that institutional abuse. So whether or not the numbers are going up and more concerns about things happening to kids in schools, et cetera, right? The race, poverty, and neglect subcommittee is really looking at how are we educating what are the typical mandated reporters. So that's typically law enforcement, healthcare professionals, and educators, who are the ones who typically call the hotline because they have the most interaction with children and families.
Yeah.
And are they understanding what is abuse and neglect? And are we understanding why they're calling? And we have some information on that, because maybe they're calling because they don't know where else to call and they see a family that needs help. And how can we make those connections to help families, as opposed to making them in the system, involved in the system unnecessarily, because that also causes trauma, right? That investigation. We're also seeing that there is an overrepresentation of kids of color, especially African American and Black children. And so do our systems have some biases that we really need to acknowledge and change, right? Could that be training issues? Is that an awareness issue? Or are there other issues why people pick up the phone? So they're working on those things. I think I'm trying to think of the SOARS committee is going to continue its the work that it's doing to kind of assess or do a performance review. And they've picked a couple other topics that they want to look at, things like services, just the flex funding that the department uses to help families, and a couple other things. So they will continue that work. So then all of that work comes back to the task force. And then the task force, like you said, there's members of the legislature, 2 senators, 2 assembly people, both parties are represented, who might then say, well, this is something we can fix, right? And then they could advocate for legislation. I think right now, conversations we had at our meeting earlier today was really, how can we help get the word out about these federal cuts that are going to have a devastating impact on all the great work that has been done over the last 10 or 20 years to help families, especially the Medicaid, but also the SNAP and the potential TANF funding, et cetera. So I think that, to me, was what I walked away from the meeting with. And that's something that at ACNJ we are already working on, so we will continue that work. But I also think there is, to me, there's an awareness that we need to do more education. And so that everybody in New Jersey understands that they are part of the child welfare system and that they do have a role to play, even if it's a small role mentoring a kid or becoming a CASA or joining a child placement review board. I mean, there are things that people can do, not having to spend a lot of time, or becoming a resource parent, a foster parent, right? Or an adoptive parent, or becoming a trainer for Umbrella. So there's many things. I think kids need help with reading. Parents need respite care. But I also think people should check in on their neighbors. Right? I think there's a lot of anxiety out in the world today for a lot of different reasons. And I think people forget that sometimes just reaching out to a neighbor and saying you care and you can be there to support can make all the difference for a family.
Absolutely.
And in those actions that people can do, they can also donate to the Children's Trust Fund. Children's Trust Fund Small steps make a big difference.
Absolutely.
You're gonna see like a pop up just come at the blows.
I think we are going to put the link
There
at
you
the
go.
yeah.
There you go.
Yeah, I think we might put the link at the bottom.
Yes, Jason has his marketing plan rolling out.
Yeah.
Well, thank you so much for joining us today, talking with us about the task force, and
Yeah.
look forward to continuing to work with both of you to make that vision a reality.
It was a pleasure.
Thank you
for
so
having us.
much. Yes.
So in our conversation with Mary around SOARS, she specifically mentioned data. And data is the topic of our next podcast episode. We're going to be hearing from how the department uses data to make informed decisions around the child welfare system. How are we putting services out there that are responsive to the needs of New Jersey residents? And then how are we being transparent with our data so that people can look at our goals and our mission and our work and say that we're being held accountable to that. So I do want to thank our guests again, and on behalf of our producers and the Office of Communications and Public Affairs at the New Jersey Department of Children and Families, thank you for tuning in, and join us next month for more DCF on the Air.